And the American Psychological Association is warning of the potential impact if the court does strike down Colorado's conversion therapy ban. It reports LGBTQ plus youth who underwent conversion therapy are more than 2 times as likely to report attempted suicide and more than 2.5 times as likely to report multiple suicide attempts. For more, let's bring in emergency psychiatrist Dr. Adjoa Smalls-Mantey. Dr. Smalls, thank you so much for being here. Such an important topic. So, in a brief submitted to the court, the APA is arguing that sexual orientation and gender identity change efforts don't meet the criteria of legitimate therapeutic treatment, that they can be harmful, discredited practices, and that they're not supported by credible scientific evidence. Can you explain why?
Many studies have shown that this form of therapy is not helpful. In fact, it is actually harmful. And the harms that we have seen are that people feel a lot of shame about who they are. That is reinforced in these therapies. They may also go on to develop anxiety and depression. And many studies have shown that it increases your risk of suicidal thoughts or people even going on to take their own lives. And not only does it affect the individual that is being treated, but also those around them. Sometimes there is blame put on the parents for the upbringing, for the experiences that people have had. And so from all of our evidence, this has not worked in changing people's gender identity or sexual orientation. So if it is a therapy, it's not effective.
The plaintiffs argue there's no scientific evidence to prove talk therapy is harmful to minors experiencing gender dysphoria. What's your response to that?
And I would have to say that is incorrect, that therapy is a form of treatment and we know that it has to be done correctly. If you start to open up certain issues, explore certain things in any type of therapy for any reason, if you're not doing it in the proper way, at the proper time, it can be detrimental to people. We have found, again, like as I said, that people feel more shame, more guilt, more isolation, more depression, and that can lead to many more serious consequences, as we previously stated.
Our David Muir interviewed a Colorado mother who says that her daughter was, in her words, a girly girl until she was about 12. And then she started experiencing some confusion around gender. And I want to play a clip for you of what she says happened next.
She just wanted someone who would talk to her about what she was going through, and this counselor was dodging the issue entirely, and that was making our daughter worse.
And you think that's a direct result of Colorado's law?
Oh, I know it is. And the law, as I very clearly, it's very clearly written, and as I interpret it, it prevents counselors from being able to help kids through their gender confusion. They can only help them in.
So her daughter now says she's not a boy, she was just really confused. So what do you make of this mother's complaints that these laws limited the way a therapist could even talk to her and kind of only allow the therapist to, in a way, convince her daughter?
So the therapist sounds like they were not comfortable in exploring people's gender identity, and that is not what we are saying that has to be stopped. What we are saying with the law is that you need to try to stop changing the essence of who people are. That is the problem with conversion therapy. So exploring your identity, exploring issues that you're going through is actually routine in therapy, and it sounds as if that therapist felt that by that law they might have been limited, but that is not the intent of the law.
So they should be allowed to talk to a teen who just says, hey, I'm confused, about the possibility that you're just confused, you're a teen.
100%.
One of the many things you're going to be confused about as a teen.
Yes, we're all growing, we're all learning, and so we are all exploring different things in our life that is okay to talk about.
What else do you think people need to know as we watch this case unfold?
I think it's important to remember what overall is the effect of conversion therapy if that is now allowed to happen more broadly in different areas of the country among minors. Again, we have seen time and time again that this has not been effective. It leads overwhelmingly to harmful effects. And so this is not only a question about free speech, it is actually about therapy, about medical treatment, and the first tenet of medicine is to do no harm. And that is what we do not want to do with potentially opening up this box again.
All right, psychiatrist Dr. Adjoa Smalls-Mantey, we appreciate you coming in today. Thank you.
Thank you.